Question 1. A nurse is caring for a client who is prescribed an opioid analgesic for pain. What is the most important assessment to perform before administering the medication? A. Level of consciousness. B. Respiratory rate. C. Blood pressure. D. Pain level. Answer: B. Respiratory rate. This question tests the nurse's understanding of essential safety precautions when administering opioid analgesics. The most critical assessment before giving an opioid is the respiratory rate because opioids can cause respiratory depression, meaning they slow down a client's breathing, which can be life-threatening. While other assessments like level of consciousness and pain level are important, respiratory depression is a priority concern that directly impacts client safety. For example, if a client's respiratory rate is critically low, the nurse should hold the medication and notify the healthcare provider immediately. Always prioritize airway, breathing, circulation when thinking about client safety with medications. Question 2. A nurse is providing discharge teaching to a client newly diagnosed with type 2 diabetes mellitus. Which statement by the client indicates a need for further teaching? A. I will check my blood sugar levels at least once a day. B. I should eat sugary snacks if I feel shaky or dizzy. C. I will try to exercise for 30 minutes most days of the week. D. I need to look at my feet daily for any cuts or sores. Answer: B. I should eat sugary snacks if I feel shaky or dizzy. This question evaluates the nurse's knowledge of essential education for clients with diabetes, specifically regarding managing hypoglycemia, low blood sugar. The statement indicating a need for further teaching is about eating sugary snacks when feeling shaky or dizzy because while these are signs of hypoglycemia, the immediate treatment should be a fast-acting carbohydrate, not just any sugary snack, and sugary snacks should generally be avoided for regular consumption in diabetes management. Clients should be taught to consume 15 grams of a simple carbohydrate, like 4 ounces of juice or regular soda, or 3 to 4 glucose tablets, and then recheck their blood sugar. Regular sugary snacks contribute to high blood sugar levels and are not the correct first line of treatment for hypoglycemia. Remember to always educate clients on specific, measured treatments for low blood sugar to ensure safety and effective management. Question 3. A nurse is caring for a client with Clostridium difficile, C. difficile, infection. Which personal protective equipment, PPE, should the nurse prioritize when entering the client's room? A. Gown and gloves. B. Mask and goggles. C. N95 respirator and gloves. D. Surgical mask and gown. Answer: A. Gown and gloves. This question focuses on the appropriate infection control precautions for a client with C. difficile, which primarily spreads through contact. C. difficile is a spore-forming bacterium, meaning it requires contact precautions to prevent its spread. Therefore, wearing a gown and gloves is essential when entering the client's room, as this protects the nurse from direct contact with contaminated surfaces or bodily fluids. Hand hygiene with soap and water, rather than alcohol-based sanitizer, is also critical after removing PPE. Always remember that for contact precautions, protecting your skin and clothing with a gown and your hands with gloves is paramount. Question 4. A nurse is assessing a client who is postoperative and notes bright red drainage on the surgical dressing. What is the appropriate term for this type of drainage? A. Serous. B. Purulent. C. Sanguineous. D. Serosanguineous. Answer: C. Sanguineous. This question tests the nurse's understanding of different types of wound drainage, which is crucial for assessing wound healing and identifying potential complications. Sanguineous drainage refers to fresh, bright red blood, indicating active bleeding, which matches the description of bright red drainage. Serous drainage is clear, watery fluid, purulent drainage is thick, yellow, green, or brown and indicates infection, and serosanguineous drainage is a mix of blood and serous fluid, often appearing pinkish or light red. Accurately identifying wound drainage helps the nurse communicate the client's condition effectively and intervene if needed. Think of sanguineous as signifying blood, so bright red blood means sanguineous. Question 5. A nurse is preparing to administer medications through a nasogastric (NG) tube. What is the most important initial action the nurse should take? A. Crush all medications into a fine powder. B. Aspirate gastric contents to check for residual volume. C. Mix all medications together in a single syringe. D. Flush the tube with 10 milliliters of water. Answer: B. Aspirate gastric contents to check for residual volume. This question assesses the nurse's critical thinking and safety precautions related to medication administration via an NG tube. The most important initial action is to aspirate gastric contents to check for residual volume because this confirms the tube's placement and ensures the client is properly digesting previous feedings or medications, preventing aspiration or discomfort. If the residual volume is too high, typically over 200 to 250 milliliters, though facility policy varies, administering more medication could cause nausea, vomiting, or aspiration. After checking residual and returning it, the nurse would then flush the tube before administering medications. Always verify tube placement and assess gastric emptying before administering anything through an NG tube to ensure client safety. Question 6. A client with a new colostomy expresses concern about managing the stoma and changing the pouch. Which nursing action is most appropriate? A. Refer the client to a support group immediately. B. Provide written instructions and leave the client to practice. C. Demonstrate the pouch change and then have the client perform it with supervision. D. Assure the client that managing a colostomy is easy. Answer: C. Demonstrate the pouch change and then have the client perform it with supervision. This question evaluates the nurse's approach to teaching psychomotor skills and promoting self-care for a client with a new colostomy. The most appropriate action is to demonstrate the pouch change and then have the client perform it with supervision because this approach combines active learning with direct feedback, which is crucial for mastering new skills. Simply providing written instructions or premature referrals does not offer the immediate, hands-on guidance a new ostomy client needs to gain confidence and competence. It is important to encourage hands-on practice in a safe, supervised environment to ensure the client can confidently manage their own care at home. Question 7. A nurse is assessing a client who reports experiencing shortness of breath. The nurse notes the client's respiratory rate is 28 breaths/min and shallow. Which intervention should the nurse prioritize? A. Administer a prescribed PRN bronchodilator. B. Elevate the head of the bed. C. Obtain a pulse oximetry reading. D. Notify the healthcare provider. Answer: B. Elevate the head of the bed. This question tests the nurse's ability to prioritize interventions based on immediate client needs, especially with respiratory distress. Elevating the head of the bed is the most immediate and basic intervention to improve breathing for someone experiencing shortness of breath because it allows for maximum lung expansion by reducing pressure on the diaphragm. While other options like administering a bronchodilator, obtaining a pulse oximetry reading, and notifying the healthcare provider are important, positioning the client for easier breathing is a quick, independent nursing action that provides immediate relief and facilitates further assessment. Always remember to perform the least invasive, most immediate intervention that can directly improve the client's condition first. Question 8. A nurse is preparing to administer an insulin injection to a client with diabetes. Which site is most appropriate for subcutaneous insulin administration? A. Deltoid muscle. B. Ventrogluteal muscle. C. Abdomen. D. D. Vastus lateralis muscle. Answer: C. Abdomen. This question assesses the nurse's knowledge of proper injection sites for subcutaneous medications like insulin. The abdomen is the most appropriate site for subcutaneous insulin administration because it offers consistent absorption and is easily accessible for clients to self-administer. While other sites like the deltoid, ventrogluteal, and vastus lateralis can be used for injections, the abdomen has a good fat layer for subcutaneous injections and causes less discomfort than muscle injections. Remember to rotate sites within the same general area, example abdomen, to prevent tissue damage and improve absorption. Question 9. A nurse is caring for a client who is confused and attempts to pull out their intravenous line. What is the most appropriate initial nursing action? A. Apply wrist restraints immediately. B. Reorient the client to their surroundings. C. Request a sitter to stay with the client. D. Document the client's behavior. Answer: B. Reorient the client to their surroundings. This question tests the nurse's understanding of managing confused clients while prioritizing the least restrictive interventions. The most appropriate initial action is to reorient the client to their surroundings because it is the least restrictive intervention and may resolve the confusion and prevent self-harm. Before considering restraints or sitters, which are more restrictive, the nurse should attempt non-pharmacological and non-restraint interventions first. For example, reminding the client where they are, why the floor is in place, and providing a calm environment can often reduce agitation. Always prioritize verbal reorientation and environmental modifications before resorting to physical restraints. Question 10. A nurse is reviewing the laboratory results for a client with kidney disease and notes a serum potassium level of 6.2 milliequivalent/L. Which action should the nurse take first? A. Administer a prescribed loop diuretic. B. Advise the client to increase fluid intake. C. Notify the healthcare provider immediately. D. Encourage the client to eat potassium-rich foods. Answer: C. Notify the healthcare provider immediately. This question assesses the nurse's ability to recognize and prioritize a critical laboratory value. A serum potassium level of 6.2 milliequivalent/L indicates hyperkalemia, high potassium, which is a life-threatening electrolyte imbalance that can cause cardiac dysrhythmias. Therefore, the nurse's first action must be to notify the healthcare provider immediately so that appropriate interventions, such as medication to shift potassium back into cells or remove it from the body, can be initiated promptly. Encouraging potassium-rich foods or increased fluid intake would worsen the problem, and a loop diuretic might be prescribed, but only after physician notification. When you see a critical lab value, always think, is this life-threatening? If so, notify the provider now. Question 11. A nurse is educating a client about effective hand hygiene. Which statement indicates the client understands the teaching? A. I should wash my hands with soap and water for at least 5 seconds. B. I can use alcohol-based hand rub even if my hands are visibly dirty. C. I should wash my hands after coughing or sneezing. D. I only need to wash my hands before eating meals. Answer: C. I should wash my hands after coughing or sneezing. This question assesses the client's understanding of appropriate times for hand hygiene, which is fundamental to infection prevention. Washing hands after coughing or sneezing is a correct practice because respiratory droplets can contaminate hands, potentially spreading germs. Washing hands for only 5 seconds is insufficient, and alcohol-based rubs are not effective on visibly dirty hands or for certain pathogens like C. difficile. Hand hygiene should also be performed after using the restroom, before preparing food, and after touching contaminated surfaces, not just before eating. Good hand hygiene is key to preventing the spread of infection, so always think about when your hands might be contaminated. Question 12. A nurse is caring for a client who is experiencing an anaphylactic reaction to a medication. Which medication should the nurse anticipate administering first? A. Diphenhydramine. B. Epinephrine. C. Albuterol. D. Hydrocortisone. Answer B. Epinephrine. This question tests the nurse's knowledge of the immediate management of a life-threatening allergic reaction. Epinephrine is the medication that should be administered first for an anaphylactic reaction because it acts quickly to constrict blood vessels, relax airway muscles, and stabilize mast cells, thereby reversing the severe symptoms like bronchospasm and hypotension. While other medications like diphenhydramine, antihistamine, albuterol, bronchodilator, and hydrocortisone, corticosteroid, may be used as adjuncts, epinephrine is the life-saving medication for acute anaphylaxis. In emergency situations like anaphylaxis, speed is critical, and epinephrine works rapidly to save a client's life. Question 13. A nurse is teaching a group of older adults about fall prevention. Which statement is an important recommendation? A. Keep all rooms dimly lit to promote relaxation. B. Remove throw rugs from walkways. C. Avoid using handrails on stairs. D. Wear loose-fitting, comfortable shoes. Answer B. Remove throw rugs from walkways. This question assesses the nurse's understanding of environmental safety to prevent falls in older adults. Removing throw rugs from walkways is an important recommendation because throw rugs are a common tripping hazard that can easily cause falls, especially in older adults with gait instability or vision changes. Dim lighting increases fall risk, handrails on stairs should always be used for support, and wearing loose-fitting shoes can actually increase the risk of tripping. Always focus on eliminating environmental hazards to create a safer space, particularly for vulnerable populations like older adults. Question 14. A nurse is performing a focused assessment on a client reporting abdominal pain. Which question is most appropriate to ask first? A. When did your pain start? B. On a scale of 0 to 10, how severe is your pain? C. Can you describe the pain? D. Where exactly is the pain located? Answer D. Where exactly is the pain located? This question evaluates the nurse's approach to pain assessment using the PQRST, provoke, quality, region/radiation, severity, timing, or similar mnemonic. When assessing abdominal pain, asking where exactly is the pain located is the most appropriate initial question because precise location can help narrow down potential causes and guide the physical examination. While onset, severity, and quality are also crucial, knowing the specific area of pain first helps to focus the assessment and palpation. Always start by pinpointing the location of pain to guide your further assessment and interventions. Question 15. A nurse is reviewing orders for a client admitted with pneumonia. The healthcare provider has ordered oxygen therapy. The nurse understands that oxygen therapy is considered a medication and requires a prescription. This concept relates to which ethical principle? A. Autonomy. B. Beneficence. C. Fidelity. D. Non-maleficence. Answer B. Beneficence. This question tests the nurse's understanding of ethical principles, specifically beneficence, in the context of client care. Beneficence is the ethical principle that means doing good or acting in the client's best interest. Administering oxygen therapy as prescribed, recognizing it as a medication requiring a prescription, aligns with beneficence because the nurse is ensuring the client receives appropriate and beneficial treatment to improve their condition and health. Autonomy is about the client's right to make decisions, fidelity is about keeping promises, and non-maleficence is about avoiding harm. By adhering to the prescription for oxygen, the nurse is actively promoting the client's well-being and health. Question 16. A nurse is preparing to administer a subcutaneous injection to a client. Which needle gauge and length are most appropriate for this type of injection? A. 18 gauge, 1.5 inch. B. 20 gauge, 1 inch. C. 25 gauge, 5/8 inch. D. 22 gauge, 1.5 inch. Answer, C. 25 gauge, 5/8 inch. This question assesses the nurse's practical knowledge of needle selection for subcutaneous injections. A 25 gauge, 5/8 inch needle is most appropriate for subcutaneous injections because subcutaneous tissue is located just under the skin, and this needle size is thin enough, higher gauge means thinner needle, and short enough to reach this layer without penetrating muscle. Larger gauges and longer lengths are typically used for intramuscular injections. Choosing the correct needle size ensures the medication is delivered to the intended tissue layer, which helps prevent pain, tissue damage, and ensures proper absorption. Remember that higher gauge numbers mean thinner needles, which are less painful for subcutaneous injections. Question 17. A nurse is caring for a client with a new prescription for Warfarin, Coumadin. Which laboratory test is essential for monitoring the effectiveness and safety of this medication? A. Complete blood count, CBC. B. Activated partial thromboplastin time, APTT. C. International normalized ratio, INR. D. Basic metabolic panel, BMP. Answer, C. International normalized ratio, INR. This question evaluates the nurse's understanding of monitoring specific anticoagulant medications. The International Normalized Ratio, INR, is the essential laboratory test for monitoring the effectiveness and safety of warfarin because it standardizes prothrombin time, PT, results, indicating how long it takes for a client's blood to clot. Warfarin is an anticoagulant used to prevent blood clots, so the INR helps ensure the client's blood is thin enough to prevent clots but not so thin that they are at high risk for bleeding. The APTT is used for heparin, and CBC or BMP do not specifically monitor warfarin's anticoagulant effects. Always associate warfarin with INR to ensure safe and effective client care. Question 18. A nurse is assessing a client's pain level using a numeric rating scale. The client rates their pain as a 7 out of 10. Which intervention should the nurse consider first? A. Notify the healthcare provider. B. Reassess pain in 30 minutes. C. Administer prescribed pain medication. D. Document the pain score. Answer, C. Administer prescribed pain medication. This question tests the nurse's immediate response to a client's self-reported moderate to severe pain. Administering prescribed pain medication is the first intervention the nurse should consider when a client rates their pain as 7 out of 10, assuming a PRN, as needed, medication is available, because the goal is to alleviate pain quickly and effectively. Notifying the provider might be necessary if the pain is uncontrolled after medication, and reassessment occurs after intervention. Documentation should always follow assessment and intervention. Prioritizing pain relief is a fundamental aspect of nursing care, so always administer available PRN pain medication when a client reports significant discomfort. Question 19. A nurse is assessing a client who is exhibiting signs of fluid volume deficit, dehydration. Which finding would the nurse expect? A. Bounding peripheral pulses. B. Decreased urine output. C. Jugular vein distension. D. Weight gain. Answer, B. Decreased urine output. This question assesses the nurse's ability to identify key signs of fluid volume deficit, or dehydration. Decreased urine output is a classic finding in fluid volume deficit because the kidneys attempt to conserve fluid to compensate for the body's fluid loss. Bounding pulses, jugular vein distension, and weight gain are typically associated with fluid volume excess, overload. Recognizing the signs of dehydration is crucial for prompt intervention, such as increasing fluid intake or administering 4 fluids, to prevent serious complications. Remember that with dehydration, the body tries to hold on to every bit of fluid, leading to less urine. Question 20. A nurse is caring for a client who is prescribed NPO status for a surgical procedure. The client asks for a glass of water. What is the nurse's best response? A. You can have a small sip, but don't drink too much. B. I understand you're thirsty, but you cannot have anything by mouth right now. C. I will ask the doctor if you can have some water. D. Drinking water won't hurt you, it's just a precaution. Answer: B. I understand you're thirsty, but you cannot have anything by mouth right now. This question assesses the nurse's ability to provide therapeutic communication while adhering to safety protocols for a client with NPO status. The best response acknowledges the client's feeling, I understand you're thirsty, while clearly and firmly stating the necessary restriction, but you cannot have anything by mouth right now, to ensure client safety before surgery. Giving even a small sip or suggesting that drinking won't hurt can lead to aspiration or cancellation of the procedure. While asking the doctor might seem helpful, NPO orders are typically strict for pre-surgical clients, and the nurse must uphold this safety measure. Always prioritize client safety by strictly adhering to NPO orders and communicating empathetically yet clearly. Question 21. A nurse is teaching a client about self-administration of eye drops. Which instruction is most important to include? A. Instill the drops directly onto the cornea. B. Apply pressure to the inner canthus after administration. C. Use the same bottle of eye drops for multiple family members. D. Tilt your head back and look down before instilling the drops. Answer: B. Apply pressure to the inner canthus after administration. This question tests the nurse's knowledge of correct eye drop administration technique to maximize medication absorption and minimize systemic effects. Applying pressure to the inner canthus, tear duct, after administration is the most important instruction because it prevents the medication from draining into the nasolacrimal duct, which could lead to systemic absorption and reduce the amount of medication that reaches the eye. Instilling drops directly onto the cornea can cause discomfort and injury, sharing drops can lead to infection, and looking down makes it harder to access the conjunctival sac. Proper technique ensures the medication works where it's supposed to and avoids unwanted side effects. Question 22. A nurse is assessing a client's peripheral pulses. The nurse documents a pulse as 2+. What does this finding indicate? A. Absent pulse. B. Weak, thready pulse. C. Normal pulse. D. Bounding pulse. Answer: C. Normal pulse. This question assesses the nurse's understanding of the standard grading scale for peripheral pulses. A 2+ pulse indicates a normal pulse, easily palpable and not easily obliterated with pressure. A 0 indicates an absent pulse, a 1+ indicates a weak, thready pulse, and a 3+ or 4+ indicates a bounding pulse. Accurate documentation of pulse strength is essential for assessing circulation and identifying potential cardiovascular issues. Knowing the pulse grading scale helps you quickly communicate your assessment findings and recognize deviations from normal. Question 23. A client reports difficulty sleeping due to anxiety. Which non-pharmacological intervention should the nurse suggest first? A. Administer a sedative. B. Encourage daily vigorous exercise before bedtime. C. Advise consuming a warm beverage like decaffeinated tea before sleep. D. Recommend watching television in bed until falling asleep. Answer: C. Advise consuming a warm beverage like decaffeinated tea before sleep. This question tests the nurse's knowledge of non-pharmacological interventions for sleep promotion, especially for anxiety. Advising the client to consume a warm beverage like decaffeinated tea before sleep is a gentle, non-pharmacological intervention that can promote relaxation and ease into sleep. Administering a sedative is a pharmacological intervention. Vigorous exercise close to bedtime can be stimulating, and watching television in bed can be counterproductive as screens emit blue light that interferes with melatonin production. Always consider conservative, less invasive methods first to help clients improve sleep without relying on medication. Question 24. A nurse is providing care for a client who is prescribed strict bed rest. Which nursing intervention is most important to prevent complications of immobility? A. Encourage client to perform deep breathing and coughing exercises. B. Administer prophylactic antibiotics. C. Provide a high-calorie, low-protein diet. D. Limit fluid intake to prevent bladder distension. Answer: A. Encourage client to perform deep breathing and coughing exercises. This question assesses the nurse's understanding of interventions to prevent complications of immobility. Encouraging deep breathing and coughing exercises is the most important intervention to prevent respiratory complications like atelectasis, lung collapse, and pneumonia, which are common in clients on strict bed rest. While other interventions might be part of the care plan, preventing respiratory issues directly impacts the client's physiological adaptation. Prophylactic antibiotics are not a standard universal intervention for immobility. Diet should be balanced, and limiting fluids can lead to dehydration and kidney stones. Prioritize maintaining respiratory function by promoting lung expansion and secretion clearance when a client is immobile. Question 25. A nurse is reviewing a client's medication list and notes that the client takes both aspirin and ibuprofen. What is the primary concern with taking these two medications concurrently? A. Increased risk of sedation. B. Increased risk of gastrointestinal bleeding. C. Increased risk of kidney stones. D. Increased risk of hypokalemia. Answer: B. Increased risk of gastrointestinal bleeding. This question tests the nurse's knowledge of potential drug interactions, specifically with nonsteroidal anti-inflammatory drugs, NSAIDs, like aspirin and ibuprofen. The primary concern with taking aspirin and ibuprofen concurrently is the increased risk of gastrointestinal bleeding because both medications inhibit platelet aggregation and can irritate the stomach lining, increasing the likelihood of ulcers and hemorrhage. They do not significantly increase sedation, kidney stones, or hypokalemia. Always be aware of potential additive adverse effects when clients are taking multiple medications in the same drug class, especially those that affect bleeding.